Okay. Dr. Jeremy Barnett, Emergency Registrar, Hospital Lakewood. Okay, so all these things are fine. Okay, very well. I'm writing to urgently refer Mr. Alvin, who has presumptive diagnosis of anterior myocardial infarction along with the acute exacerbation of asthma. Further assessment and management would be appreciated. Very well. Today, Mr. Alvin presents and not presents exactly, has presented, if you want to mention, because presents mean present indefinite, something which is never going to be completed, which is never going to end, or you don't know when it's going to be, completed. So that's how. So you can't say that this particular present or today will stay forever. Okay.
Okay.
As presented and complained of sudden excruciating chest pain along with severe asthma and upper respiratory tract infection. On his chest examination, there are mild crackles and wheeze. Not a wheeze. Wheeze can't be one. And wheeze, and his saturation has been 86%. You can write along with saturation of 86%.
Mm.
Okay, now see, now it's making sense.
Okay.
His ECG shows mild ST elevation. Again, not shows, has showed.
Mm.
Better to write this way. Has showed mild ST elevation in the anterior lead and his heart rate. Okay, and his heart has F3 sound positive during auscultation. Therefore, Mr. Alvin has been immediately resuscitated and transferred to the relevant department. See, I mean, that is something you are referring this patient for, right? Okay, so that is something you're. This is the reason you're referring the patient. So you are not saying that you have transferred the patient to another department. Okay, because the department here is the registrar and the emergency department is there. So you are a GP. The patient has come to
Mm.
you. Okay, so GP
Mm.
can't have another department in the GP.
Okay.
Okay, yeah, so you don't need, as I mentioned last time as well, you don't need a lot of confirmation and explanation. If you would have
Mm.
written this much, it is completely fine. There is no need to further elaborate that he's whether being referred or not. Okay, initially Mr. Alvin came and complained of occasional chest pain, especially during exertion along with mild asthma. His examination has had
Yeah.
been unremarkable. An early stage ischemic heart disease was suspected on assessment. Therefore, he was advised to check his serum lipids and to perform an exercise stress test. Okay, on his review visit, Mr. Alvin had a runny nose and pharyngitis with increased symptoms of asthma. He mentioned that he had mild chest pain during his stress test, and his investigations revealed slight ischemic changes in exercise test and mildly increased cholesterol. Consequently, he was commenced on Lipitor nitrates and anginine. On subsequent visit, Mr. Alvin's condition. Okay, now this way. Mr. Alvin's condition had been not improved, and he also reported non-compliance with medication due to alcohol dependency. Therefore, he was advised to put a written reminder for all medications on the fridge, and was educated regarding importance of anti-asthma medication and pharmacotherapy for ETOH dependence. That's it. There is no need to write was also suggested, because you are referring this to the previous was educated regarding and this and that. Okay.
Okay.
Please note that Mr. Alvin smokes and drinks moderately. Now, why I'm writing smokes and drinks? Because this is something which you don't know. It's an
Mm,
indefinite in nature. You don't know whether he's gonna stop. You don't know whether he's gonna continue. You don't know anything. It's something which is indefinite in nature. He might
okay.
continue smoking for rest of his life,
Mm, okay.
and he has been not interested in changing his habits. There, he takes salbutamol and seretide for asthma and has no known allergies. Fine. In view of the above, I would be grateful if you could further assess Mr. Alvin's condition.
No.
Should there be any queries, please feel free to contact me. Okay, so that's it. This is overall, if you ask me, it's fine. Few smaller mistakes are there, but today's visit could have been improved. This is important, and there are not many mistakes except this has and had, which we had
Mm,
discussed earlier. Well, apart from that,
mm,
everything is almost fine. Okay, so just do not make these mistakes and try not to elaborate excessively. Okay, don't think that I have to write
mm,
everything. Okay,
okay.
just hold on yourself. Okay, that's the important thing.